Erectile dysfunction is defined as the inability of a man to attain or maintain erection firm enough for sexual intercourse. You as a man, when you cannot attain, or you can attain but you cannot maintain erection that is firm enough for vaginal penetration, such condition is referred to as erectile dysfunction. Erectile dysfunction is different from premature ejaculation. In premature ejaculation, you release semen from the penis within 1 minute after vaginal penetration. That's premature ejaculation. But in erectile dysfunction, you cannot attain or even maintain erection that is firm enough for even vaginal penetration. Now, the question is, can erectile dysfunction be cured, or can oral medications cure erectile dysfunction? Now, the truth is, whether erectile dysfunction can be cured or not depends on the cause of erectile dysfunction. On that note, let's talk about the causes of erectile dysfunction. Now, the first cause of erectile dysfunction is lifestyle activity. Your lifestyle activity can predispose you to erectile dysfunction. Activities such as smoking, the use of alcohol, sedentary or physical inactivity, obesity or overweight. These activities can predispose you or make you come up with erectile dysfunction. Now, if your erectile dysfunction is caused as a result of physical inactivity, or is caused as a result of alcohol, quitting this habit even without medications can improve your erection. Now, another factor that can cause erectile dysfunction is underlying such medical diabetes, conditions, high blood pressure, high cholesterol, also known as hyperlipidemia. So if you have these conditions and you're having erectile dysfunction, your erectile dysfunction may be as a result of these medical conditions, or one of these medical conditions. Now, another factor that can also cause erectile dysfunction is the use of hard drugs. The use of hard drugs can also cause erectile dysfunction. Hard drugs such as amphetamine, hard drugs such as heroin, hard drugs such as cocaine, and hard drugs such as marijuana can cause erectile dysfunction. Now, also, if your erectile dysfunction is caused as a result of the use of hard drugs, quitting the use of these hard drugs can reverse your erectile dysfunction. If you cannot quit, you have to talk to your doctor. Your doctor may recommend means, possible means that you can follow in order for you to quit this habit, in order for you to improve your erectile dysfunction. Now, another factor that can also cause erectile dysfunction is medications. Some medications have erectile dysfunction or impotence as one of their side effects. Medications such as the antioxidant drug known as H2 receptor antagonists, such as your cimetidine and ranitidine, are known to cause erectile dysfunction. The antihypertensive drug metidopa, that's alpha-2 receptor agonists, clonidine and metidopa, they are known to also cause erectile dysfunction. The medication finasteride anti-androgen is also reported to cause erectile dysfunction. And also the diuretic spironolactone is also known to cause erectile dysfunction. And the antihistamine diphenhydramine, the antihistamine, is also known to cause erectile dysfunction. Now, if your erectile dysfunction is caused as a result of this medication, you stopping the use of this medication may reverse or improve your erection. However, never you stop taking any medication that is prescribed to you by your medical doctor or your healthcare provider without seeking the advice of such or that healthcare provider. Now, another condition that may also cause erectile dysfunction is injury or surgery to some of your vital organs. If you have injuries or surgery to one of your vital organs, such as your penis, your prostate, your pelvis, your bladder, if you have injury to any of these organs, it can cause erectile dysfunction. Now, another factor also that can cause erectile dysfunction is hormonal imbalance. Now, some persons have low level of the hormone known as testosterone. Now, research has shown that patients that have low testosterone usually come up with erectile dysfunction. So, recommended oral medications that are used for the management of erectile dysfunction. Now, the known medication or the class of medication that is proven scientifically and recommended for the management of erectile dysfunction is the class of drug that is known as phosphodiesterase 5 inhibitors. Phosphodiesterase 5 inhibitors, and two well-known and common examples in this class is the tadalafil, branded Cialis, and also the sildenafil that is branded Viagra is another well-known example in this class that your doctor may recommend for you for the management of your erectile dysfunction. Now, let's now talk about the side effects of these medications. Now, sildenafil and tadalafil have similar side effects. Now, the major difference between sildenafil and tadalafil is just their duration of action. The major difference is in their duration of action. Tadalafil has a longer duration of action. It can last you for about 36 hours, while sildenafil is only active for 5 to 6 hours. The duration of action of sildenafil is about 5 to 6 hours. So it has a shorter duration of action. Now, what are the side effects of these medications? Side effects include, the most common side effect is headache. Most patients that use these medications come up with headache, complain of headache. Another common side effect is dizziness. Some patients come up with dizziness. Then some patients come up with stomach upset, while some patients come up with nasal congestion, and some patients even come up with flushing. Do well to subscribe to my YouTube channel and like this video. Thank you so much. See you in my next video.